Good evening. I am so excited to be chairing this first of a four-part mental health and well-being series organized by Rabbi Hackenbach of Woodside Park Shul, with the sole aim to increase mental health awareness and support within our community. Just 3 months ago, we were capable of knowing and planning, yet right now we have been thrown a curveball. Major changes have come our way. We all find ourselves in a storm, yet at the same time, we are not in the same boat. The social isolation, loneliness, illness, grief, financial uncertainty, they have been experienced by every single individual and household, but they have been experienced very differently. Yes, for some it has been a time to thrive and get closer and stronger. Yet for so many others, this has been a time of silent suffering and inner turmoil. We are left with many questions of when, where, and who, questions of how we will establish ourselves whilst facing this unique, unseen enemy. What research has taught us, but so many of us will know from our own lived life experience, is that the more questions, the more uncertainty, the more stress and crisis we face. The quicker we can talk and think and address the trauma, the greater the prognosis for healing and well-being. Viktor Frankl, a Holocaust and Auschwitz survivor, teaches us in his book, Man's Search for Meaning, that when you encounter suffering without meaning, you will face despair. But if you can find meaning alongside the suffering, it will encourage you to weather the storm. So in this four-part series, we will be looking at ways that we can discover meaning amidst the storm. Tonight, we have invited a panel of individuals whose life mission it is to minimize emotional and sometimes physical turmoil for the individuals they work with. They all represent incredible charities that are the flagships in our community. They will share how they have managed and addressed the issues that have arisen as a result of COVID-19, and will give of their time to help us understand what support is available to manage the changes that have been brought onto us. When I was thinking of introducing our fabulous panelists, a quote by the Dalai Lama comes to mind. When he was asked what's his one tip he has to increase people's level of well-being, he replied, "You do that by caring for and making other people happy. Give to others. It's the power of small acts of kindness." Thank you to the three of you for your kindness by making yourselves available tonight. And thank you, Richard, for all your work behind the scenes. As the Mental Health Family Liaison Team Lead at Camp Simcha, I was delighted to have been asked by my husband to chair tonight's evening. At Camp Simcha, we aim to make a difference for seriously ill children and their families. Just recently, Camp Simcha has launched a pilot project to try bring those same services, which bring tremendous joy and happiness to the whole family of the seriously ill child, to families with a child suffering from a mental health illness. As we have just launched, we have started with 2 specific categories, and please feel free to contact me at any time if you would like more specific information about our very new project, as I'm eager to now start and introduce our very special panel of this evening. On our panel tonight, we have Paula Castro, Team Manager at Jewish Care. Paula has transformed the way we think of palliative care in our community, and her contribution to making people's end-of-life journey more comfortable while abiding by our cultural norms is huge. Shelley Gilbert, the founder of Grief Encounter. Shelley has taken her personal tragedy, her personal storm, and created a lifeline for others so that no child or family has to suffer through bereavement on their own. Having done consultancy work for her charity, I know firsthand of the difference it makes for many families and children. Louise Kermode, Head of Services at Jamie, is passionate about supporting individuals with mental illness. Having done some training with her, I know how dedicated she is to bring those changes forward and share them with other organizations who promote recovery in mental health. So, Paula, would you want to start by telling us a bit more about what it is that you do at Jewish Care, and possibly add a bit of information about the organization that you work with?
Sure. Well, quite simply, I became a mature student doing a 4-year degree in social sciences, qualifying as a social worker in 2002. The last year of my degree was in palliative care, igniting my future passion for all things related to death and dying. I began working for Jewish Care in 2002 as a newly qualified social worker, and guess what? I'm still there. It's such an amazing place to work. Focusing on social work, Jewish Care has 5 geographical teams and 4 learning forums: dementia, disability and welfare, family carers, and end of life. And I'm proud to be the end of life team manager, and I'm privileged to work with my wonderful, wonderful colleagues. And our aim is to educate colleagues and raise awareness of end of life and palliative care, both internally and in the community, creating strong links to empower people to achieve a good and meaningful end of life. Personally, I'm married to the most wonderful Andrew, and I have 2 amazing sons, Matthew and Edward, and 2 gorgeous daughters-in-law, Minnie and Elizabeth, and of course, the most wonderful granddaughter in the world, Lily, from Edward and Elizabeth. And Minnie and Matthew are imminent in production, please God. And my beautiful friend Shelley, who is also the auntie of my wonderful daughter-in-law Elizabeth. That's me. And I'm a proud member of Woodside Park.
Thank you, Paula. That's very much in a nutshell, but I think you've given us an idea of the incredibly important work that you're doing. And we are waiting for Mazel Tov. So
Thank you. Thank you. Please go.
Please go. Louise, do you want to share a bit more about what it is that you do at Jamie, and add maybe a few lines about what Jamie stands for and does in the community?
Absolutely. Hi, yeah, my name's Louise. I'm an occupational therapist, and similar to Paula's story, actually, I was a student at Jamie 8 years ago, and never left. So it's been a really wonderful journey to see how we've sort of grown as a mental health organisation over those years. Yeah, as you said, I'm really passionate about mental health and how we can sort of reduce the stigma and discrimination that surrounds mental illness and mental to support our well-being as well. Jamie is the community's mental health organisation. We work with people to live a meaningful life. Our hubs, our building-based services. We also have a team that go and do a lot of outreach to people within the communities. We have we support those who are caring for people.
Louise, your internet is not as strong as we would like it to be, so I'm just going to move over to Shelley. Or do you have any devices that you can switch off?
And do something with that. I know it's been a bit dodgy, it's been freezing.
It's a bit dodgy. So I'm going to go to Shelley whilst you sort your internet out, if that's okay. So Shelley. Hi, Shelley.
Hi, good evening.
Same question to you. Do you want to tell us a bit about yourself? And then if you can add a bit of information about Grief Encounter.
I was bereaved. I was orphaned by the time I was 9. And I grew up in having lost both parents. I not only lost both parents, but at that time I also lost my school, my friends, my identity. I had to move, and my whole world was blown up overnight. What I understand now, which I didn't know really at the time, was the adults around me were just protecting me from the pain. But I kept my story silent for 30 odd years, or a very, very long time. And I, not unsurprisingly, worked in the helping professions and decided to become a bereavement counsellor, specialising in my area of discomfort, as many of us therapists do. And I found myself in a position of being able to look for a resource or somewhere to put what I was learning or learn from, not only from my own experience, but also from the experience of the bereaved children and families I was meeting, which was expanding in numbers. And I couldn't find that resource. So I thought, well, I'll write it. And I wrote it down in a book that I expected a few of my aunties and uncles to buy. And the book was very cleverly titled by my wonderful Myers family, and it was titled Grief Encounter. I was absolutely unprepared for the public reaction to that book when it was published in 2003. It received, and there were very strong messages in the book, and they were very well received, and we were helped along the way by a very special man called Kevin Wells, whose daughter was murdered in Soham. And that propelled the book to be a bestseller, and it continues to be a bestseller. A little plug here. I'm now rewriting it. This is a sneak preview of what it's going to look like. No one else has seen that. So what goes on in this meeting stays in this meeting, please, guys. But so the learning and rewriting this book was, well, the learning from the book was that the response, I was asked to set up places where people could see counsellors, where people could meet, and set up unknowingly how to do this, set up the charity. And it's now one of the UK's leading charities, and it is open access. And the result of the COVID virus has been one of the good bits. It's had to become even more open access through its helpline, but that's another story for later.
Yes.
Yeah. So here am I, privileged to have been able to turn something into good, something really of a great tragedy into good, and I'm very, very proud of taking the Jewish way of thinking out into the secular world.
What can I say? What can I add to that, Shelley? Just incredible what you've managed to do out of your own storm, as I mentioned before. Thank you. Thank you.
Thank you.
Louise, I'm going to come back to you, and hopefully we can hear you now.
Hi there. Yes, I will briefly run through that again. Apologies, everyone. I've switched my router now, so hopefully you'll be able to hear me now. So yeah, I was just briefly, you know, Jamie, as a mental health organisation, we support people to live a meaningful life with or without symptoms of mental ill health through our community hubs or outreach programs, our social enterprises, and our vocational and educational services as well. And I think a really important part of that is supporting people who are caring for people with a mental health illness as well. So yes, I've been at Jamie for 8 years now, and really enjoyed my journey with Jamie so far.
Well done. It's also incredible work that Jamie does. So thank you for that, Louise. So I'm going to start with some questions to bring it back to the here now, while we struggling with COVID. So my first question to you, Paula, would be, what specific challenges have you seen that have come up related to the COVID crisis? Has anything changed in your work? And if you want to tell us a bit more, if it has.
Well, yes, of course. The answer immediately is a yes, of course. For me personally, I was immediately asked to support care homes with the do not resuscitate questions. And I feel quite strongly about this, that the press weren't very helpful in terms of saying that there are blanket decisions relating to do not resuscitate, certainly not at Jewish care. Every individual is treated as an individual. And we also have the discussion with their family if the resident in our care home can't participate due to cognitive impairment. So that was my personal main focus, having those I think actually privileged conversations to get into the life of individuals and help them make these very difficult decisions of how they want their life to end. But with regard to maybe my colleagues, social work colleagues, we also had to immediately work from home. So that's a major change. So a lot of the team, you know, I don't have young children at home to think about, and some of my team did. So it's how they were juggling that complexity for themselves, and some of them have older parents to think about as well. And also, I think to make sure that we were monitoring my team's own well-being. You know, when you walk around the office, you can feel people's body language. We didn't have that. We're all online. So it's just, and also acknowledging that the team may have similar emotions to people that they're supporting, fear of catching COVID. So I think also visitation of families visiting their parents, aunts and uncles in care homes, that stopped, and the pressure that was on our care staff. So, and I think also the team were thrown into talking about death and dying right in their face. So that's just a very quick overview from me from that question.
Thank you very much, Paula. And I'll move on straight to you, Louise. Same, what's
yeah, I think, you know, the mutual support that Paula just mentioned, I think has been really wonderful, but also creates a lot of challenges when you're supporting people as part of your service. And I think that there's some really things to learn there, as well as those challenges. I think, you know, we know that social connections, meaningful occupations, and routine, financial security, as you mentioned some of those things earlier, they're vital for to support our good mental health, and to aid recovery for people who are suffering with distress. You know, the fear and uncertainty that's impacted on all our lives, I think, is being significant. But for people who already have illness and disability as part of their life, you know, these pre-existing conditions, you know, the impact has been enormous. And I think when we closed our doors, you know, it really was, you know, very apparent that, you know, our business is all about connecting people to us, to each other, and forging that social network and that social capital that we have so much of, and being able to have to compensate for that in different ways. I think another issue has been that other services closing their doors or reducing their support. So that's had a big knock-on effect for people already struggling. So there's those people who are impacted on directly by this situation, and those who were already struggling as well. I think similar to Paula, you know, for teams to suddenly be working in isolation, to not, you know, it's great to have video conferencing and platforms like this where we can meet, but they're quite exhausting and they can be difficult. So actually, we've been thinking about different ways of having more informal meetings with staff to try and compensate for that debrief or, you know, chat you'd have with a colleague when you're making a coffee, which is really important as part of your working day. And I think taken away, it really impacts on your well-being at work as well.
You got me curious there. How have you found ways to compensate for that, like the coffee in the coffee?
We have, you know, we've made sure that we have had an informal coffee and chat for all staff every Wednesday. Initially started as a response to the situation to be able to update everyone and get everyone together. And now it is literally a coffee, bring your coffee, have a chat. We break out into rooms and have a very informal conversation. There's no agenda, which is trying to sort of, and making sure that people have time to debrief with people without an agenda. And I think that's been really important. And using some of the functions on Zoom, like breakout rooms, has been important. I think there's just been being really mindful about checking in with people when you would normally check in with them, because you're sat next to them in office. But interestingly, we're normally spread over lots of different buildings. So actually, this would have been great before the pandemic as well, to be able to connect everyone in this way.
I'm sure there's things we're going to take with us from this period that we wouldn't have dreamed of doing before. So thank you for that, Louise. Shelley, what about a grief encounter?
Yeah, I hope you're right, Gila, that we are going to take things from this. There's two streams of concern for us now. From the initial cheering, and I know Paula joins me on this. Yeah, we're all talking about death and dying. Yeah, that's fabulous. Which, if you're my kids or Paula's kids, is a very, very strange way to be brought up, but hey ho. So there's two strands of concern now. One is, will we, or will some people return to their previous patterns? How long are they going to maintain their levels of interest in death and dying? And the second strand will be, okay, so the elephant, what we call the elephant in the room, where no one talks about things. So if the elephant is out of the room, which has brought a lot of cheer to us, how can we support that? How can we change that how can we break that elephant down into small sized pieces so that we can, as an organisation or organisations, everyone's included here, we can support them. And the whole business, this whole COVID business, in our minds as psychologists, psychotherapists, has paralleled the grief process, and it starts off with the massive explosion, the trauma, the shock, the traumatic reactions, fight, flight, freeze, fragment. I'll add in two to that. So we've worked with the trauma, the shock, and it's impacted everyone directly. And then what we call the second phase, which is the longer term work of usually longer term, of processing that grief, that's broken into different strands again. So now we're thinking about, well, how do we support that isolation? How do we make sure that doesn't turn into boredom? I don't know if anyone's read The Life of Pi. I'm sure most of you are familiar with that. And it's normally publicised in very different ways. And I struggle hard to find the themes of loss and death in when people are talking about The Life of Pi. But actually, it is an absolutely central theme. Pi's mum, dad and sibling are lost to him in front of his eyes, and he's left on his own, not knowing if he's going to survive. It's a great read, and one of the quotes from there which sticks in my mind is that boredom is one of death's great adversaries. So that is so true. We can see people just switch off. They don't even flight. They're just switched off completely and don't want to engage. They don't want Viktor Frankl's meaningfulness of life. And some do check out. They do lose the will to live.
So Shelley, just to stay with you on that point, can you think of one resilience tool you would suggest for? I'm jumping ahead. I'm going to jump a bit back and forth. But when you speak about getting stuck in that boredom state, can you think of one tool that might be helpful to suggest? Your grief book. Can you share with us one helpful pointer in your book?
I guess I mean resilience is the key. So we all face the stress, and and the ones that emerge are the ones that use their resilience to face the adversity. So there's not really one tool in particular I can think of, but certainly to open the conversations, not to bury the feelings, not keeping them inside.
So what you've been talking about, keeping the talking going, kind of remove the elephant from the room by talking and by keeping those conversations going. is a
Yeah,
good start. That's a
and
good
not
start.
only talking, taking that one step further. So talking and listening, that's what we need to do. And when you've done that listening, the children, people have to find a new language of grief. So it's a long road. The resilience tool has to last a very long time.
I agree. Thank you, Shelley. I'm going to go a bit more personal if you're happy to answer personal questions. How did you personally, Paula, cope with the changes? Is there something you want to share that was helpful or not so helpful?
I think, on a funny note, I think the most important thing was getting Andrew to learn how to use the washing machine. I think, no, I think for me, is change frightens a lot of people, and I think what I've learned is that we all had to change literally overnight. We had to all find new ways of surviving. We were all in a lockdown. You all stay at home, and whether you've got no children at home, no dependents, you will do this. And we were forced to do it. And actually, you know, as I'm feeling, the ceiling didn't fall in. We had to do it. But of course, you know, I think crisis can build resilience. You either find out your strengths and not your strengths. And I think, excuse me, I think someone will take the phone. Sorry if you can hear the phone ringing. I just feel that it's how we support our team to sorry, I don't know if you can hear, my phone is ringing. I hope it's not giving birth, but and I think for me also is understanding that it's okay to feel frightened as well of things. I really think that's important to acknowledge. Yeah.
Thank you. I heard Tal Ben Shachar speak last night, and he spoke about it's okay to be human. It's okay not to be okay.
Yes, absolutely. You know, absolutely. So I think change, as I say, sometimes people struggle with worrying about change, but here COVID you were forced to do it. And actually some people have found the strength to cope with it and some people haven't, which is, I mean, I know that sounds basic, but it's with regard to team support, it's how we support people through that. In order, with regard to my hat on Jewish Care, is how we support the people coming through to our helpline. We have to be strong to support the people who need us the most at that time, although we might be internalizing our own fears.
Thank you.
I think there's something really powerful about mutual support, though, and I collectively experiencing something together, which is really important, and us, you know, not separating ourselves out, you know, from those kinds of issues, and being really kind to ourselves as well, because, you know, actually feeling really, you know, down one minute, feeling really anxious the next, feeling fearful the next, and going through these really roller coaster of emotions at the moment. It's really normal. It's absolutely the appropriate response to a really difficult situation. So I think reminding ourselves that this is a normal response to an unprecedented situation, and that we're all in something together can be, I think, quite powerful. I think having a routine and being able to stay connected and all those things we know are important.
One thing I'd like to say that I really learned actually is with all the COVID legislation thrown at us health professionals. I'm a bit of a bookworm. I love to read about this. One thing came to mind is something called moral injury. I don't know if anyone's heard of it. It's from a Professor Neil Greenberg. He's president of UK Psychological Trauma Society. And I found this really empowering to acknowledge and to help the care staff I've been supporting and my team to learn about this. And he talks about psychological distress from action or no action, violating someone's moral or ethical code. It helped to understand mental health challenges of healthcare workers faced during COVID-19 and how to develop the right support to help people. And it's really about, I felt that our team perhaps were faced with, were they doing the right thing? Did they do enough? And what could I do to save people? And that's a big, big pressure on them. And it's offering empathy, that to say that we recognize where you're at and thank you for really caring. And when we actually offered that kind of theory into our staff support groups, I think it helped them to be recognized that they're doing their best and thank you. And I felt that was quite powerful. I wanted to share that.
That's really powerful. So I'm still left with the question, Paul, are you supporting your team? What did you do to support yourselves that could maybe be helpful for our listeners here tonight?
Well, to support myself, I know my family are listening. They're amazing support to me. That's number one. My team are amazing. My manager, my team manager colleagues, I know I can go to them at any time. And if I needed to at night, I could as well, but I didn't. And my social work team, we have built a strength of support and collaboration. So for me, that's my immediate response. I knew I had their strength and support, and I could go with them to discuss strategies to help our community.
So being able to ask the right people for support.
Absolutely. But I think it's important to understand that that was already embedded.
Right.
It wasn't something I had to scrabble for. It was already embedded.
Yeah. Louise, do you want to add anything to this?
Yeah, I think just in terms of personal support, I think, it's really important to be able to have that network of support personally and professionally. And I think both are really important because, the personal and the professional right now is really difficult to put a boundary between. I think it's a really hard one. So I think, working in the field that we're in, that's where we need to be really aware and be able to have our support systems in place. So having support systems and accessing them, because that's sometimes the hardest thing. I think I've noticed that the busier we've been with this crisis and the more that's going on and the more that we're responding to the increased demand, the less we're looking after ourselves. And that's something that we need to keep to the top of the list, is making sure that we things like doing paint by numbers and baking, and for me it's things that kind of take me away from the everyday and having some distraction and having something that means I don't think about some of the bigger issues that are going on. So I think we call it trying to find some balance, I think, which I'm still looking for it, but I think it's really important to have that on the agenda.
So you're looking at the self-care. Thank you for that. Shelley, Dr. Shelley, do you want to add anything?
No, I think Louise and Paula have come up with some very interesting ideas. We've found we've had to work harder at communicating. So communication, just as Louise was talking about. There's no IT support. It is very isolating. There is a lack of resources, but there is a way to build the platforms, especially as Paula said, you've already got a relationship. I think what we found the biggest challenge really is after getting people to do the counselling online, but the biggest challenge after that is actually to, as Louise was saying about, looking after yourself.
Thank you, Shelley. So I'm going to move on to another question.
Can I ask
yes?
all of you a question? And this is kind of a struggle. This is my next Michigan, if you like. And it's about why we calling mental health. Part of my learning along the way has been, I read quite a bit about neurology and or read what people write in English. I don't read the direct stuff, But we are learning lots more from 4D images, the fMRI scans, but we don't quite seem to be using the information yet. And some of that information following a trauma is how our mind and our body, our thoughts, feelings and behaviours are split following a trauma. And our work is about helping to heal that work. And to do that, I think it is absolutely essential that we see our body as a system. Why are we still thinking of the brain as a separate muscle or entity? There is evidence now that the brain is linked with liquids and neurons and things that move around to the rest of our body.
Yeah.
Even with children, and in rewriting the stuff I'm rewriting, it's to actually not only see the body as the body, but also to ensure that all those systems are linked: the brain, the nervous system, the gut, and that's the way when I think we should be talking about health not as mental.
So you're speaking about a much more holistic.
Yeah.
Yeah, I need a new word. I think people switch off at holistic. So
I think there's something,
Louise, yeah,
really problematic about some of the language we have around mental health and mental illness, and I think we've been on a real journey with it, and I think we've got a long way to go. There's a bit of a problem with looking at something that someone needs to fix, that there's something wrong with someone that needs to be fixed about them, because actually, as you say, Shelley, when we think about trauma informed models and approaches, actually we're a product of our experiences and our external factors, our socio-economic environment, all those kinds of things. Like we're seeing about the impact of COVID-19, these situations, these external forces and the trauma that people may have experienced because of being ill or the grieving process are all, we know they're going to lead to further mental health issues. That's not something that needs fixing in someone. That's about, understanding someone's experiences and then being able to support somebody with those experiences. And in some place that's going to be healing and that kind of trauma work you mentioned, Shelley, and in some instances giving people that environment that people can flourish in. So I agree, there's a lot of problematic language around mental health, mental illness, and I think we're still looking, but I think trauma-informed care and support is a really nice way of trying to frame some of those issues without us labeling somebody as broken and needs fixing, because I think that's a problem.
So going further on that, Louise, bringing it back to COVID, is taking that approach. What legacy do you think we will be left with from COVID, and what type of healing or support will we need to be seeing? And I'm not sure if this question is premature, but yeah.
No, I don't think it is. I think, so far we know for a start that a lot of our services weren't as accessible as they could have been. A lot of the people that we've been able to reach through our virtual services, virtual programming, had issues coming to our buildings and meeting with people before. People who are really struggling to leave their house and engage with us. Actually, this might be a really nice way of being able to support people going forward. I think some of the mutual support groups in the community that have started up, people going to help people get their prescriptions and do their shopping. People needed this before because of mental ill health. I think, just people would be more, I think, aware of supporting a neighbour who is in a wheelchair than they would be a neighbour with anxiety. And I'm hoping that this will change. I certainly know that going to the supermarket for me is littered with barriers right now, and I'm sure it is for everyone. It's an anxiety provoking situation. Being worried about your loved ones, being worried about getting ill, fear of contamination, social isolation, being unable to leave your house. This is stuff that people have been living with for years before COVID-19. And I really hope that a lasting sort of legacy from this situation is that we all understand a little bit better, and that we have better support systems in place in the community to be able to continue some of the great work that's happened as a result of the pandemic.
Thank you. So more understanding.
And again, reducing that stigma and discrimination as well, because if we it's a mutual place of mutual support, means there's less stigma there's less discrimination, because I think we all can have an understanding now.
So you're speaking about that, the understanding, the legacy should be actually a better understanding what the consumer, what the people we service need, and also us staying in the framework of keeping that support ongoing, like now during the crisis. Yeah.
Absolutely.
What do you think?
Yeah.
What do you think the one tool we need is to keep that in our, that we don't go back to normal? What will remind us kind of to keep whatever we're doing right now, to keep that for the future? What do you think, Louise?
I think remember how we've been feeling, remember how this impacted on us and our own lives. I think there's something really powerful about that. The idea that in fact, I'm more fearful that we go back to normal and I think there's something, really powerful about remembering how we feel. Often when things hurt and they're scary and they're frightening, we want to run away from it and we want to kind of push it to one side. And at some point this will be over and we will get back to our normal lives. But I think just engage with that a little bit and feel that. And I think that's really important, because I think that will help us going forward.
Thank you for that. Paula, what do you think? What do you think?
Yeah. Oh, well, I definitely, for me, it's been an overwhelming, observation of people not being able to be present to say goodbye to people who are dying. I think fear of dying has been worldwide. If you get COVID, you might die. And I think of course, it's been more prevalent for people in a very long age. But of course, we've heard sad stories of young people dying. So death and dying has been worldwide. And so I think the cultural norms have been taken away, with regard to our own culture. In the earlier days, you weren't allowed to be present when someone dies. You're robbed of that. And the cultural shiva has been taken away as the usual pathway. And that is, I think, a mental health legacy. My mother, father, aunt, uncle, whatever, deserved to have a wonderful eulogy given to 100 people. That's been taken away from you from COVID, and it's that regret. And I also feel that, again, I always bring this in because it's ingrained in me. Dame Cicely Saunders was the founder of the hospice movement, and she said, how someone dies remains in the memory of those that live on. And I feel that just, encapsulates what I'm trying to say here, really. And that I feel that what I want to take forward, and I hope the world has seen, it's important to talk to your family and friends, those you feel you want to share important information before you lose capacity, or you can't, you're not in a fit state to say, that they know what your wishes and preferences are, so that they in turn can grieve well themselves and have a good mental health. So for me, that's a really important message. It's my journey and my passion to get out to society. And I feel that I hope people will remember that fear of talking about planning doesn't bring your end closer.
So your legacy and your tool to deal with it would be have these important conversations when you still can.
Yeah. So that your family or friends are not left wondering, what did they want when I'm asked? Because in a best interests medical decision, your family and friends are included. And if you're feeling, I didn't ask them, you're feeling so burdened. And it's horrible for you to take the mental health legacy forward. I didn't ask them because I was frightened to upset them, or they were frightened to upset me.
Thank you for that, Paula. And Shelley, any last words on this question?
I think it's very important to embrace the new technology, well, not so new, but the technology, and work with the positives. Online counselling, memes, Twitter, etc., memory keeping, all these kind of different ways we can do what is so important. And to follow on from Paula, there's also ways where after we die, we can reach you from beyond the grave. So what I really missed was that messages from the person who had done and who died. And a lot of my thing now is about creating remembrances and memories and memory making, so that we have got access to them, even though they're not physically here on Earth.
Right. Wow, very powerful, all three of you. That leaves us with a lot to think about.
Keely, you didn't answer my question on mental health.
I didn't, because I'm looking at the time, and I think your question merits a whole evening of conversation. So I'd love to kind of schedule another conversation, maybe with the four of us again, just addressing your question, Shelley, because it's a very important question when we're speaking about healing and we're speaking about health. And in 2020, we know the relationship between our bodies and our brains. Nothing works on its own. So why do we still just use the word mental illness? I'm with you. I'm told, and language to me, I'm also systemically trained. So language is so nuanced, and it's so important to get our language right, for positive and for negative. And we're seeing this today with the discrimination in the world. It's so much about languaging things. So I'd love to have a full hour conversation, or even longer, on your question, Shelley. So I don't think I'd do it any justice in the 5 minutes that are left to us.
Bless you.
And I think the most important bit there as well is about the needs that people are coming with as well. In fact, some of the language that we use is, some people are going to agree and disagree, but actually when we think about what is it that people need when they come to our service, and then how can we help them, actually sometimes that can get around some of the issues around language and what the causes are, and some of that other stuff. What are the needs? And if we focus on the needs that people have, I think that's a much more straightforward of actually meeting those needs in a really person-centered way.
Yeah. So one of I heard of the most helpful question during COVID was, how can I be helpful to you? Rather than what's wrong, just how can I be helpful? Each of us every morning can ask the people we are with, via Zoom or in person, is what do you need today? How can we be helpful to you? I think already, Shelley, we're on a journey of answering your question and bringing that change into the world. I hope.
And also, much of it I'm leaving to the next generation. Over to you, Louise.
So one, I'm going to just ask Louise and Shelley in one sentence. Is there anything you'd like to see changed in the Jewish world in regards to, I'm going to use mental health, mental healing, any wisdom, one thing?
I think just to reiterate what I've already said is that there's such a wealth of social capital community already in the Jewish community, that I just hope that we can continue what's been increased and the networks that have already kind of come about, and again that understanding. So I think continuing that support, because there's already such a lot there's so many incredible networks there, so continuing that, looking after each other going forward, because this impact on people's mental health long term. We're going to have the direct consequence and we're going to have the indirect, and that's going to be taking us quite a long way down the road. So I think about us just being mindful, looking after each other, knowing how to access support and help for yourself or for the people around you, I think is really important.
And Louise, can I ask you one question? Is what symptoms are there any symptoms we should be aware of and of people we are with?
I mean, that's probably a whole session on its own. I think if you're concerned, ask someone. I think be open, ask someone. If you're worried about them, check on them, ask them if they're okay. If they're not okay, have a chat and see how you can get them some help. So I think it can be as simple as that. I mean, obviously there's mental health first aid and mental health awareness courses and the various other courses that we run at Jamie that can go a bit more in detail, but generally it's that simple. If you're worried, ask someone and start a conversation.
Thank you, Louise. And Shelley, any last thoughts on one thing that we could change in the Jewish world?
Yeah, thanks for asking me that, because I work both in the, as you know, in the non-secular and the secular. And following on from what Paul says, that we miss the most between in the COVID, is I am so proud when I go out into the real world of of our Jewish ways of mourning and grieving.
Yeah. Yeah.
I mean, people go back to work after someone special has died.
Yeah.
As if nothing has happened, or even if nothing, they've got 5 days bereavement leave after they've experienced the death of a child. I mean, really? And that's it. And, alongside with that is the values that I've been brought up with as a Jew, that we all have, which you've mentioned and referred to a lot of times along the way, Gila. The ones of tzedakah and the ones of chesed, they're so ingrained, aren't they, in our Jewish values and morals, and this community stuff. Our first thoughts are of community, aren't they? And I'm so proud. So would I want to change anything? Yes, I would want to change that we get it out there far more.
Yeah.
That's really lovely. Thank you for that, Shelley. So we're coming towards the end of this. I could continue chatting to the three of you till it stops raining outside. But I'm just wanting, this is, as we mentioned at the beginning, this is the first of a 4-part series on well-being and mental health. Our second session is on June the 24th at 8 o'clock. It will be a workshop, so you need to sign up for it. There's limited spaces. And it's on building resilience during COVID-19. And it will be run by Emma Dorman. And she's the Senior Education Coordinator at Jamie. So sign up, don't miss the boat. Our third session is on July 1st, again at 8 o'clock, and it's another workshop, so again, please sign up. And it's multi-generational family strategies for well-being during COVID-19, and this will be run by Kim Carr from Worth It. Again, it's worth it to sign up for that. And our last and final session is not going to be a workshop, so you will not need to sign up for it, but it's an inspirational talk on July the 8th, by Simon Weston, CVE, who's just an inspiration. So I would urge all of you, most of you, to sign up for those that are interesting to you, or just join us again with Simon Weston's talk. Louise, Paula, Shelley, this was so insightful, so inspirational, and it has left me with a tremendous feeling of appreciation to all that you do day in, day out, and a huge sense of gratitude that despite the challenges, we have such caring and capable people, organizations, like Shelley said, in our midst. And please God, we should come together for easy things, for good things. But while the need is there, that we should have the energy to continue being that which we need to be. Thank you so much. Richard, I need to thank Richard Wilver so much, because the four of us, he really set us up tonight with all the technicalities behind the scenes. So huge shout out to you. And then it's all that's left to say is thank you and good night.
Good night.
Thank you, Gila.
Thank you, Gila.